As this year's World AIDS Day is observed today with the theme Universal Access and Human Rights, preventive education remains the strongest social vaccine against HIV/AIDS epidemic worldwide. Over the past 27 years, nearly 25 million people have died from AIDS. The World Health Organization said that HIV/AIDS is still a serious public health problem, although some countries were witnessing a downward trend in new HIV cases. Children are the most vulnerable group, with such cases having increased by 46% between 2001 and 2009. Globally, an estimated 33.3 million people living with the virus and 2.6 million were infected in 2009. As Nigeria joined the rest of the world to celebrate World Health Day, the Minister of Health, Dr. Christian Chikwu, said Nigeria will not relent in its support for the eradication of AIDS and universal access to services.
May we use this occasion on World AIDS Day to renew our collective efforts and commitment to totally stop the spread of the virus in our beloved country, Nigeria. While every effort is being made to develop medical means of prevention here and in the field, the immediate and overriding priority must be given to the great education for positive behavioral change to reduce infection rates. In the absence of the discovery of corrective vaccine, creation of awareness and behavioral change should be effective strategy. This is the time to wake up for our responsibilities as parents, media, community members, civil society, development partners, and those agencies in whose hands lies the key to prevention and control of HIV/AIDS.
On his own, the Director General of National AIDS Control Agency, NACO, says there's still more work to be done. He also spoke on the year's theme, End Prostitution in the Nation.
It's a reinforcement of last year's theme. And if you really want to drive to 2015, the only way to do it is keep emphasizing that, because universal access means that by 2015, everyone, almost everyone, 80% of those who want to access services should access them. And those services include prevention, treatment, care, support, orphans, vulnerable children, etc. So we need to emphasize universal access. Why do we need to emphasize human rights? The reason is that amongst the HIV population, those who are infected, some of those with very high prevalences are people who have no political voice. Their human rights is sort of, how would I say, is undermined. And I'm giving an example now. Sex workers, men who have sex with men, IDUs. And in these populations, the prevalence is extremely high. In fact, we believe that it is in this population, or this population that is fueling the general epidemic. You cannot criminalize sex work and expect to get results. We need to work with sex workers to ensure that they can protect themselves from sexually transmitted infections, including HIV, such that they do not pass it on.
The students also contributed.
How I can help in using, or rather spreading the news, is by educating people around me. As a student of my standard, I will educate people around me and tell them the outcome of AIDS, what it does to people, and also advising the government to create more organizations, mostly in the rural areas where they are not well enlightened about this, so that they will have a very clear view about HIV and AIDS in Nigeria.
It could be as a result of their parents' life, which is bad. So in order to prevent the spread, as in the increase in numbers, they can help prevent it by educating people, even in the villages, because not all of them know the effects of AIDS in the society and the dangers it can cause. So they spread the AIDS education, teach them that AIDS is bad, and teach them how to abstain from it.
According to a new report by United Nations AIDS, Nigeria has gone down by more than 25%, while $225 million world credit has also been approved by the federal government to further control the spread of the disease. Shayo Adebomi for Internet Television International.